Hello, so today we're going to be looking at Chapter 2, Health Needs. And the aims and objectives of today's session are that by the end of the session you will have discussed the different health needs of individuals of varying age groups, children, adolescents, adults and elderly, and you will have listed social care available to individuals. So we're going to start by looking at social care and what social care is. So for a few minutes, just have a think about what you think social care is. So social care is an umbrella term for care provision, and it includes home care, day care, community care and residential care. Home care, so that's people receiving care in their own homes. Day care, a day centre visited by people to have their needs met during the day with activities run to stimulate the mind. They usually have a main carer at home. Community care, so this could be for people with physical and or learning disabilities or people with mental health problems. Also covers children's residential care and foster homes. And residential care, so this could be for elderly people in nursing or residential care. It could be for a specialist place for people with physical disabilities such as spinal cord injuries, and a secure unit for people with mental health problems, or respite care for people after an operation like a hip replacement. So you may be familiar with some of these terms. You may have maybe already thought about some of these care provision. It might be something that you're interested in actually moving into once you've completed the course. And obviously you've looked a little bit at care provision over the last few weeks, and also you've looked at people with you've looked at mental health, you've looked at dementia, and you've looked at autistic spectrum condition. So as I say, these are something that you may be interested in and already thought about working in some of these areas. So we're going to look a bit further now on social care and which professionals can help. So social professionals include a GP, a dentist, nurse, carer, speech and language therapist, physiotherapist, mental health support worker, befriender, social worker. Okay, but how can they help? So the next few slides are going to talk a little bit about each one, which will help you to do the task when we come to the question. So I'm just going to give you a quick overview of each one, but by all means, do some further research and have a look if you want to know some more information about each one, or if it's something that you particularly are interested in, in your future career. So the role of the general practitioner, the GP. So the role of the GP can include assessing, diagnosing, treating and managing illnesses. They promote general health and well-being, and they act as patient advocates, supporting and representing a patient's best interest to ensure they receive the best and most appropriate health and or social care available for their needs. Next one is the role of a dentist. And the role of a dentist includes promoting oral health and disease, prevention and monitoring growth and development of the teeth and jaws. The role of a nurse. So a nurse is a caregiver for patients and help to manage physical needs, prevent illness and treat health conditions. Their role can include administering medication, taking blood pressure, temperatures, writing records. The role of a carer. That can include practical tasks such as tidying the house, washing, ironing, cooking meals, paying bills, shopping, personal care including dressing, washing, lifting, giving medication, collecting prescriptions and attending doctor's appointments. The role of a speech and language therapist. So the role of a speech and language therapist can include life-changing treatment, support care for children and adults who have difficulties with communication or with eating, drinking or swallowing, support for people who have physical or psychological reasons and have problems speaking and communicating. The role of a physiotherapist. So that can include helping people affected by injury, illness or disability through movement and exercise by providing manual therapy, education and advice. Mental health support. Support worker can include providing support for people who have mental and physical health needs. They can also provide assistance with daily tasks like bathing and, similar to what we talked about before, bathing, washing, helping people get dressed, shopping, things like that. A befriender. So the role of a befriender is usually on a voluntary basis and it can include support and companionship to lonely or emotionally distressed people. They may visit someone for an hour or more a week, giving the person someone to talk to, have a cup of tea with them, and just being generally there for somebody to talk to and listen to. The role of a social worker includes working with adults, children and families and often specialises in a specific field of work such as support for children and families or working with adults with physical disability or mental health related needs. So you've looked at the different roles of the healthcare professionals, and what you are going to do now, you're going to look at some case studies of people from different age groups. You're going to look at a child called Noah, an adolescent called Sally, a young adult called Cynthia, and an older adult called Ali. Now you need to read each one and then write down in your workbook their health needs and what social care is available for each one. Now I want you to think about the healthcare professionals in the previous slide, so this will support you when you're looking at your answers. And use the next slide to support your answers also. Okay, so we're going to look at the 4 different case studies, and there is a slide after all the case studies that gives you a little support also with what the health needs and the social care available if you are unsure. So also make sure you use that slide as well. So you've got the you need to read the case study from your workbook. So we're going to talk through Noah now. So Noah is 5 years old and has lived in foster care for 3 months. He visits a contact centre 3 times a week to meet his birth mother and father, who both have learning disabilities. Noah's parents live in council house on a local estate. They are independent but have visits from children's social services when Noah lives with them due to concerns. Their GP reported that Noah's personal hygiene was not looked after and that he was not meeting his milestones as expected. Social services noted that the house was messy and disorganised, with a Tesco shopping trolley full of litter in their living room. Noah was moved into foster care because his parents were unable to meet his needs due to their learning disabilities, though they love him very much and he enjoys the time in the contact centre with them. Noah has a small vocabulary of words for his age group and often stays quiet because when he talks he stutters and jumbles words. But he is big for his age, though in both height and weight, and the BMI chart says he is obese, though his carer is unsure why he isn't losing weight because he struggles to chew meals as his teeth are badly decayed. Noah recently joined the local primary school near to his foster placement. He often shouts out in class and gets frustrated easily. He has a one-to-one teaching assistant in the classroom to help him, and he has yet to make any friends. So what you need to do, you need to think, what are Noah's health needs? That's your first thing you need to think about. And then when you've thought about what his health needs are, what social care is available to Noah to support those health needs. So you will see on the next slide, Noah's health needs are his diet. He needs a healthy diet. As he is overweight, he is obese, so he actually needs a healthy diet to sort that out. He needs exercise due to his obesity, so this could help him lose weight if he's getting more exercise. Socialising. He needs to improve his vocabulary, his behaviour and interaction skills to build friendships. And other needs. So he needs to see a dentist due to decaying teeth. He needs to learn to communicate better and he needs to improve his hygiene, that which will help him to become independent. So social care available to Noah. So community care, so he's already, he's in foster care, and health professionals, so speech and language therapist because of his communication, a dietitian because of his weight, dentist, his teeth. He has a teaching assistant, he has a one-to-one teaching assistant, assessment by the SENCO, which is a special educational needs coordinator, and he needs to visit local community groups to build social skills, and that will help him to be independent and make some new friends. Okay, so we're now going to look at Sally. And Sally is 16 years old and has recently moved into supported living accommodation with 24-hour care with another young female who has Down syndrome. Sally goes to college 3 times a week for art, dance and drama classes, which she enjoys. Sally has learning disabilities and epilepsy. Sally has difficulties with learning new things, including language, and has a small vocabulary. Sally finds social situations difficult sometimes. She cries quite often because she cannot say how she is feeling, but she does know some basic Makaton. Sally lives with her mum, dad and older brother until she moved out and is from a very loving home. Sally misses living at home and seeing her family every day. Sally's parents chose to move her to supported living so she could become more independent. They also chose to hand over their care responsibilities for Sally before they get too old to care for her. Sally has many different carers working shifts in her home, and the only person she sees regularly is her housemate, but she does not know her very well either. So Sally's health needs. She has epilepsy, so she needs medication timely. Sally's learning disability means she has many social needs, so she needs to learn new words. She needs to feel more comfortable with staff, her housemate, and with her new surroundings. She also needs to learn to be independent. The social care available to Sally. So Sally needs to live in 24-hour care in the community. So a speech and language therapist could help her with vocabulary. A support worker is needed to care for Sally. A social worker can support her with her friendship with her housemates, and an occupational therapist could help her to settle in. Cynthia is 35 years old and has a spinal cord injury. She tripped while carrying laundry downstairs and fell and injured herself. She is now paralysed from the chest down and uses a wheelchair, which aches her arms to push. She no longer has bowel or bladder control. She lives with her husband, Eamon, and their twin boys, aged 9. They own their own home and have had to put the bed downstairs as Cynthia can no longer get upstairs but cannot afford to move to a new house. She can only have bed baths as there is no accessible shower. The twins have had a few days off school due to illness and have been late 3 times in the last month. Cynthia keeps getting letters from school but struggles with timings in the mornings as her boys are young carers for her. The boys are often angry and upset as they get told off for being late for school by their teacher, even though they have been up early trying to help their mum. Eamon is around to help at the weekends, but he works long hours to support the family on weekdays. Cynthia can no longer work, which she misses as she was a nurse. Cynthia is starting to feel down and depressed because she cannot parent her sons like she used to and feels like she is letting them down. She wonders if they would be better off in care during the week. When the boys are at school, Cynthia is isolated and spends her days in the house alone. So what are Cynthia's health needs and what social care is available for her? So Cynthia's health needs are her diet. She needs a healthy, balanced diet due to a paralysis. She needs exercise. She needs to do upper body workouts to strengthen her arms for her wheelchair. She needs her incontinence, hygiene and nutrition needs met by a carer. Socialising. She needs a befriender as she's very lonely when her children are out at work and her husband is out at work also. Her children are at school and her husband is out at work in the week. What social care is available to Cynthia? Well, home care, so she needs to have support workers at home. She needs daycare, so she needs to try and socialise maybe at a daycare centre. Cynthia and her family need to see nurses, psychologists and the social worker to help them access to the support required for her and for all involved. Ali is 67 and has recently retired. He has been enjoying his retirement by spending as much time with his 7 grandchildren as he can. Ali has recently noticed that his knuckles on his hands have become bigger, and this makes it difficult to lift his grandchildren up and to push the pushchairs around. He saw his doctor and said this is called clubbing and is probably arthritis. But he has been sent for a chest x-ray to rule out lung cancer, as clubbing can be a symptom, especially because Ali keeps getting bad coughs and requires antibiotics. Ali has had type 1 diabetes for several years. However, recently it has been causing him problems with his sight and his feet. His vision goes cloudy, so he has had to stop driving because it was no longer safe. Ali doesn't mind not driving as he has a bus pass, but his feet get very sore if he walks or stands for too long. If he walks too far, he gets blood blisters form, which are very painful for Ali, and he must rest for days to let them heal. This means he spends a lot of time at home or in his local neighbourhood as he can't get far when they are sore. Ali jokes about his ill health and says he was fit as a fiddle up until his retirement. He says he would be better off working and keeping busy so that he would not notice himself getting old. So what are Ali's health needs and what social care is available for him? So Ali's health needs, so his diet. He needs to eat a balanced diet and limit his sugar as he's diabetic. Exercise, he needs to try alternative exercise to walking to take the weight off his feet, so he could try swimming. Socialising, he can't go too far to socialise, so he needs to find local pubs that he can access. He's diabetic type 1, so he needs regular insulin, so he also may need antibiotics for chest infections. He needs to get his eyes tested and he needs to get his feet seen to also. Social care available to Ali, so he needs a district nurse to care for his blood blisters and to possibly administer his insulin. He needs to see his GP. He needs to go and see a radiographer for his x-ray. He needs a social worker to access care in the community. He needs to see a podiatrist for his feet, and he needs to see an optician for his eyes to get his eyes checked. So to finish up the session, I want to just look at over the aims and objectives that we started with. And once you've finished this session and answered the questions, you will see that we've discussed the different health needs of individuals of varying age groups. So you've looked at children, adolescents, adults and the elderly. And you've also listed social care available to each of those individuals.